everyone. Nice to meet you again. So last week, Dr. Dhingra covered the topic over treatment or not. So today we're doing further and talk about a very important question, medication. So as a therapist, I get asked a lot regarding should my kids take medication. So what are the usual signs for that?
Well, I tell the parents that therapy is always a more important treatment for the kids. And that's the first step. When the child comes to the clinic, first he or she meets with a therapist, there's an evaluation.
Mm-hmm.
After that, it's to be decided if the child will benefit from therapy. Many times it's not clear in the beginning, but then the child comes for therapy. Um, and if the therapist feels that things are not improving fast, or there's a safety issue that needs further interventions, sometimes it's very clear that therapy alone is not going to be enough, medications are needed.
Mm-hmm.
Then there's a discussion between the therapist and you know psychiatrist, and then if it's decided that yes, maybe some medication is going to be useful, then we decide to discuss that with the parent and the child.
Mm-hmm. So it's also okay for the parents to see you without any medication to be prescribed. Is that correct?
Yeah, so as we emphasized last time also, if it's an evaluation, don't worry about this pressure that you may have on yourself about medications.
Mm-hmm.
So after evaluation, a psychiatrist can tell you that this is the situation, this is what therapy can do, this is what medications can do,
Mm-hmm.
and we take it from there.
Yes, so it's really about the evaluation and for the psychiatrist to give you the professional view on how helpful the medication can be. Can you, so very often parents have concerns about the side effect about the medication. So what are the common side effects of the medication?
That's a good question, but um, it's important to understand that there are so many different types of medications.
Mm-hmm.
Um, so it all depends on what medication the child is going to be taking. It's a psychiatrist's job to explain the benefits, potential benefits,
Mm-hmm.
and the side effects of the medications. Many a times, parents are concerned because they, go to the web and they try to explore on their own what's mentioned on the internet. And although the information may be correct, but then they don't know the prevalence of these side effects. So my job is to tell them what's common, what's uncommon, what should they watch out for,
Mm-hmm.
and if there is a side effect, what to do about it. Because not all side effects are dangerous, not all side effects are significant.
Mm-hmm.
Sometimes they're just self-limiting. I mean, they are there for just a few days and then they go away.
Mm-hmm.
So that discussion is very important.
Yes, so it's not really one answer for every medication. It's case by case, and it's important for you to really let the parents explain the consequences of each medication.
Yes, medications, they are different chemicals, they work on the brain differently. So having a generalized notion about all medications is not good.
Mm-hmm. So will they actually cause brain damage?
That's a very common question that's asked.
Mm-hmm.
Brain damage is a serious thing and it's not to be taken lightly. So
Mm-hmm.
these medications don't cause brain damage. Brain damage would mean that someone's part of the brain stops working
Mm-hmm.
or gets permanently damaged. No, that doesn't happen. There may be side effects, and but I make sure that I tell the parents that if a medication would cause brain damage, then why would I prescribe it to a child? The purpose is to make the child feel better and excel, not to impair him or damage his brain. So no, these medicines do not cause brain damage.
Definitely do no harm. That's very important.
Yes.
Mm-hmm. So how long usually is one treatment period? Like how do I know my case is getting better?
It varies from case to case, but it's important to understand that a child's brain is growing.
Mm-hmm.
His personality is still developing.
Mm-hmm.
So we don't plan a very, very long-term treatment because if there's a temporary problem, the child may either grow out of it, or with medication, he may stabilize fast. So the initial goal is to do the treatment for a few months if needed. Could be less, could be a little longer. Some conditions are longer lasting, like for example ADHD, so the child may need treatment for a few years. But it's important to tell the parent that there's a range. There's no set time limit for this, and at any time in future, if they decide that they do not want to continue medication treatment for their child, they can discuss it, and medications can be stopped if there's no acute risk.
So again, it's really case by case discussion. It's not all chronic, and it's not that curable as having a cold.
Right, and also I want to emphasize that sometimes if parents change their minds about medication, discuss it with the doctor. Don't just stop the medications abruptly.
Very important. Yes.
Yeah. The doses have to be modified for any reason. If your child is taking medication, suddenly giving the child a high dose is not good. But if the child is on a certain dose, stopping it suddenly is also not good. So I'm willing to stop medications for your child, but I need to know what's going on, why you want to stop, what benefits the child is getting, what side effects the child is getting, and unless I have this information, I cannot guide you on how to stop the medication and when to stop the medication.
Yes, a common thing that I see is that the parents think, oh, my child is getting better, so it's time to stop the medication. But as you said, sometimes it can be really dangerous.
Yes, and also know that there are different phases of treatment. Say, for example, a child has come to me for, say, a mood disorder, say depression. There's an initial phase. I start the treatment and I want the child to get better. But once the child is okay, the next phase is to maintain that treatment for some time. So just because the child is feeling better, that doesn't mean that automatically I'll just stop the medication. I will give information to the parent about how long this maintenance phase will last, and when we can think that, okay, now things are okay and we can think of tapering the medications off.
So communication is really the most
Very
important
important.
thing. To tell your needs to a psychiatrist, and we can figure out a plan together. So will this medication be addictive? Like,
That's also a very common question, if the medications are going to be addictive. Let's understand the definition of addiction first. Parents feel that once the medication is started, the child will have a tough time coming off of it. But addiction is a very specific thing. Addiction would mean that the child has to take medication not because he needs it, but because now he cannot function without it. So it's not the original illness that's the problem, it's the habit of taking the medication that's the problem.
okay.
Know that certain medications may have some potential for addiction, but as long as a child takes the medication as prescribed in a certain dose and tells me about what benefits or problems he or she is having, then there's no addiction. But some of these medications are controlled substances.
Yes.
And what that means is that they are sold on the streets.
Have a street value.
Yes, and they give a high. And you'll be surprised to know that sometimes kids sell their medications to other kids, and they may know more about these medications than you do. So I will tell you about those medications, that this is a controlled substance. Kids may use it to get high, and that's why we'll discuss in this session that why it's so important for the parents to hold the medications and not give those medications to the child. Don't give the whole bottle to the child. Dispense it the way I prescribe. Keep the medications under lock and key.
Yes. So by the way, the controlled medication usually have a red sticker on that. That's a sign that they are controlled medication. So speaking of medication distribution, oftentimes parents get into argument with their kids because they may not want to take it, or they want to take it by themselves. So what do you suggest?
As a general rule, I suggest that parents should keep all medications, and that doesn't apply only to psychiatric medications.
Mm-hmm.
All medications in your household, including the over-the-counter pills, Advil, Tylenol, all these things.
Mm-hmm.
Kids should not have access to these. You should keep your medications, including child's medications, under lock and key. And child should be given the medication, like say one pill at a time, and make sure that the child takes the medication in front of you. We get lots of cases, where the child is not 100% sure if he or she wants to take the medication, takes the pill, parent walks out, the child just throws the pill away. And this is dangerous.
Yes.
At like multiple levels, this is a dangerous thing. So parents have to really take responsibility.
Mm-hmm. Yeah, then that leads to a miscommunication because then we don't really know what's going on. Then medication can be even added or decreased due to what happens with the kids.
Right. I may feel that the medication is not working, whereas in reality, the child is not even taking the medication. Another important thing that's usually ignored is that when kids throw medications away, I had a patient, his mom was cleaning under his bed and she found like 40 pills, and he used to just drop the pill, behind his bed. That's dangerous, especially if you have little kids or pets. If you have pets in your household, it's very dangerous.
They can overdose.
They can overdose.
So as we were discussing, there were potential harms of miscommunication. So it's really important for us to know what's going on and if your kids are really taking the medication.
See, any medication, whether it's for psychiatric purposes or other reasons, they are chemicals. So in the right dose, they will do good to your child, but in the wrong dose, it could be poisonous. So the act of giving the medication to your child, how it's to be monitored, what to watch out for, all these things need to be discussed to ensure safety.
Yes, and I think the miscommunication thing, this can be done within therapy session. We can do a family session just to talk about what are the rules and how we can do this. But I also think sometimes it's important for the psychiatrist to let their parent know in front of the kids that this should be given by the parent, because they really respect your opinion and there will be no argument over that.
Yes, and as long as these rules are followed and the child knows that, if there is a problem with the medication, the child doesn't have to hide it. The child can talk to the therapist or the psychiatrist and express the problems, and then it can be sorted out. Because we don't want to medicate the kids against their wish also. They may be shy, they may just take the medication just because a parent or the doctor is telling them to. But, and that brings us to another important topic, the consent and the assent process.
Yes.
So let's talk about that.
Consent, okay. So parents are required to come to a session with the minors because as their guardians, they have to sign off to agree with it.
Yes, so as we discussed in the other session also, that without parents' permission, we cannot prescribe medications. That's called consent. But a child's permission is also needed, especially if the child is, understanding what's going on. In pediatrics, for toddlers or for very small kids, you don't ask for their permission. But in psychiatry, if I'm seeing like a 7-year-old child, 8-year-old child, I have to know what this child can understand and cannot. So I give the information to that child based on his or her age level and how much he or she can understand. And then if the child understands that, we ask for permission from the child also, that is it okay if I give you some medicine to help you with these issues? And if the child agrees, that's great. Some kids, especially the teenagers, they don't want to take medication, right?
And they are the master of their body and they want to have a say into what they are taking into their body.
And again, the discussion is needed, because what if the child is refusing treatment or medications for a reason that's not actually, realistic? The same questions that, the parents ask, sometimes a child may have same set of questions or different questions, or the child may feel that, why should he be different from other kids? because
Sure.
maybe, you know, it'll hurt his self-esteem to take medications. Um, all these things need to be explored because it's a psychological thing, you know. I'm taking medication, why? And why is someone putting a chemical in my body? Unless the child is convinced, the same things are going to happen again. You know, the kid is going to throw away the medication or will develop some negative feelings towards the parent, feeling that the parent is trying to force the medication or on him or her.
Okay, speaking of teenagers, what happens if the teenager are smoking a little weed, they're drinking a little alcohol around, or maybe even pregnant?
Teenagers, unfortunately, get into these habits of substance abuse. Substances are chemicals, whether it's alcohol or marijuana, or even some kids start smoking. So, if we clearly see that this is going on, then we have to refer the child for substance abuse counseling.
Yes.
Because what if these substances are causing the symptoms?
True, true. A lot of times the substance can actually induce depression, anxiety, a lot of that,
Yeah.
hypertension.
And many times we don't know in the beginning what's going on. So we may have to order like a urine toxicology or other tests to see what's in this child's system. And if there are drugs in the system, I don't want to add another chemical on top of that. So the first step would be substance abuse treatment. And you asked about pregnancy. Yes, teenagers sometimes, you know, they get pregnant. So with teenage girls, it's very important to discuss what medications can do for them, how they can harm them if they're not taken correctly, and if they're sexually active, what contraceptive measures they're using, and what can happen if they get pregnant and medications are being prescribed to them. Is it going to be harmful or not going to be harmful? This is a very sensitive area because teenage girls may not want to involve their parents in this discussion. So how much to share, how much not to share, it's a very sensitive topic.
Yes. Because we do want them to be able to trust us to give us the information, and also we don't want to destroy our relationship with them and also their relationship with their parents.
True. So there are some guidelines for that, and we try our best to stick to those guidelines when it comes to confidentiality about, you know, teenage substance abuse, pregnancy issues. But when it comes to something medical, like if we clearly know that this child is not using protection, this teenager girl is at risk for pregnancy and medications cannot be given anymore, we may have to bring it up with the parent, because then it becomes a medical issue, it becomes a safety issue.
True, true. So what if the parents have different opinion? Like say if they are divorced and they share custody, what if the mother agree and the father decline medication?
In a perfect world, both parents should be agreeable. If the psychiatrist is prescribing medication, many a times they're single mothers or single parents, they bring the child, the other parent is either not in the picture or maybe very neutral about medications. So in that case, as long as the parent who's bringing the child is giving the consent, I can prescribe the medication. But in situations when I'm very clear that one parent is for the medication, the other parent for some reason is against it, then I would need a legal document stating that what are the rights of these parents, who has the custody. If it's complete custody, like full custody to one parent, then no issues. But if they share a custody thing, then who's in charge of the medical treatment? Sometimes they have shared custody, but one parent is in charge of the medical treatment or psychiatric treatment. So as long as I have that document, I can proceed and prescribe. But if the conflict continues and I don't have a clear document stating who's responsible for the child's medication, then they may have to go to court and get more clarity for me.
Yes, and I think it's all for the best of the child, and also a reminder that if clear the child is having suicidal ideation or can be a harm to himself, and if the parents still disagree for medication, then as mandated reporter, it's possible that ACS may have to call for medical neglect, because sometimes the medication is necessary really for the safety of your child.
Yeah, I mean, a detailed discussion is needed with, say, for example, the therapist, psychiatrist, and the children's services. If we don't come to an agreement and the child is doing something dangerous, saying something dangerous, we can hospitalize the child against the parents' wishes. But over there, also in the hospital, there has to be a discussion whether the child needs medication or not, and if yes, then what are the legal routes to pursue for that condition.
Okay, thank you, Dr. Dhingra. So I think we just have a last question, which is also, I think, the most common one from the parents. Will there be a record? Will that affect my child's future if they are going to college, if they are going to military, or major jobs in future?
Medical records are confidential. The parent has to sign a consent if the medical records have to be released to any place. So whether it's another treatment team, school, in future if the child is gonna, get a summer job, we will not release the records to anyone unless there's a court order. So just because we have a record and the child is applying for some position or a place in college, we cannot and we don't release information. If the parent says yes, the child needs some special accommodations in college, and for that it'll be useful for the child if we release the information
Yes,
through the
for
college.
their benefits, and for
For
sure.
the benefits, then we say, okay, this is the information, and the whole information or part of the information will be released to that place,
Yes.
and the parent has to sign that.
Okay, so it will really be an informed decision. There should not be any surprises.
We make sure that confidentiality is protected, and but in certain situations, the court says for some reason there's a conflict, and the court says they want the records, and then we have to have a discussion and see what we can send and what we cannot send. There's a whole procedure on that, but
Yes.
that's one situation where sometimes the information is given without the parents' permission, otherwise not.
Okay, I think that's all. Thank you very much, Dr. Dhingra.
Well, it was a useful discussion, and again, there are many other, issues. Parents could have many more questions. So just email the questions to us, and we'll try our best to answer them.
Yes, or feel free to write your comments.
Yes,
Thank you
please.
for watching.
Thank you.